Good evening, I'm Ian Hannamansing. Tonight, with Canada's highest rate of new COVID cases per capita, how is Alberta responding?
I think people are eager to get back to life as usual.
What ICU staff are bracing for. Also tonight, assessing that first vaccine dose.
You are protected and you're protecting your community.
But it's not the same for everyone. Sales are up in Canadian real estate, so are complaints about agents.
There's not a whole lot of consumer protection for buyers.
And the tragedy of Canada's long-term care homes.
She is alive, she is breathing, but she has no quality of life.
The personal costs of policy failures. This is The National. While infection rates flatten in parts of the country, Alberta remains a hotspot. And the burning question for many is whether the government and people are doing enough to slow the spread. The number of COVID patients in the ICU have shot up 75% in the past 2 weeks alone, already matching the worst Alberta has seen in the pandemic so far. And many worry the pressure will increase because daily new cases are by far the highest per capita in the country and still on the rise. New targeted restrictions were announced yesterday, and Aaron Collins shows us the province is betting a full lockdown won't be necessary.
The sun was out right across Alberta today. Perfect patio weather, even with more than 21,000 active cases of COVID-19 in the province.
I think people are eager to get back to life as usual.
So pubs are open and busy here, but you won't see Calgary's mayor on one.
I mean, it's a beautiful Calgary spring and it's sunny and gorgeous and there's nowhere better to be, but things are not good.
You wouldn't know it just by looking, but the mayor says Calgary's COVID infection rate is twice as high as India's. New targeted restrictions have been brought in. COVID hotspots could face curfews, but no lockdown, not yet. The premier pleading with Albertans to obey the rules.
Go back and study once again what the restrictions are that are in place. Please follow them so we do not have to come in with yet another round of even tougher restrictions.
There is pushback to even these limited new restrictions. Government MLAs who want Alberta opened up.
We're the risk takers, we're the hard workers, we're the freedom people. And a lot of my constituents compare us to Texas. Texas opened up.
Still, COVID cases and hospitalizations continue to surge in Alberta. Many frontline workers have long called for a true lockdown that is yet to emerge.
If there are places of worship, if there are restaurant patios, if retail businesses, if those places are all open, people will continue to go to them because they feel that it's okay because the government is saying that it's okay to go to them.
This expert may offer insight into why beefier restrictions haven't arrived. He says Alberta is about to turn the corner.
We're now projecting that the cases are at its peak and are bound to come down in the near future.
Aaron, is there a sense that people in Alberta are taking more precautions?
Well, Jason, Kenny certainly hopes so. He's asked Albertans to step up to the plate to try to bend this curve one more time. Now, he has tried this before. About 3 weeks ago, it didn't work. Cases soared after that. So he's asking again, pleading really, trying to get people on board to follow the rules. And just in case they've forgotten what those rules are, the province has put them out on their emergency alert app. So people should know what they're supposed to do. Question is, will they do it?
All right, Aaron, thank you. Troubling COVID-19 trends aren't confined to Alberta. Manitoba also introduced new restrictions this week, responding to a rapid increase in infections. The province announced 295 new cases today, its highest number since mid-December. Average daily new cases have been rising all month, doubling now in just the past 2 weeks. But in Nova Scotia, the rise is steeper.
We are being overwhelmed by the number of cases and the number of tests that we have.
In Nova Scotia, today's tally of 65 new cases is likely not the full picture. Thousands of Nova Scotians have gotten tested recently, creating a backlog that may raise that number significantly. Officials hope to catch up by next week. Let's move on to the long-term care story now. Ontario investigators interviewed more than 700 people to uncover how the pandemic led to so many deaths in the province. Tonight, the independent commission released its report. Ellen Morrow explains how some of its recommendations cut right to the heart of the system.
The report chronicles the failures that led to a scale of loss that's still hard to fathom. The virus's deadly spread, fueled by shortcomings known for decades, exacerbated, the report says, by decisions from the Ontario government.
All of the signs that were there that were just ignored.
Raquel John Matazuwiski's father is in long-term care. Even before its release, she knew the report would be traumatizing.
Actually, it feels like another slap in the face. It feels like additional insult to injury to just, have all this, political theater, and then we're still hurting.
The findings are no surprise, detailing a system unprepared for a pandemic, chronically understaffed with poor infection prevention, made worse by a pre-pandemic decision from the Ontario government to cancel comprehensive inspections. During the pandemic, the report says officials were slow to act. The commission made 85 recommendations, calling on the government to urgently increase and improve staffing and step up enforcement for homes that break the rules. It also says the province should rethink how some for-profit care homes operate. The pandemic led to more deaths in those facilities. The government has promised more direct care for residents, but the commission says it's not acting fast enough, warning residents remain at risk.
It's been extremely hard on my family, and most importantly, it's been extremely hard on my dad.
Do you have any faith or confidence there will be change after everything that's happened?
I have no faith. Now I'm supposed to expect that this is now all news to the government, and we're going to do something. I don't have any confidence in it all.
Still, families hope for change, so all this loss won't have been in vain. Ellen Morrow, CBC News, Toronto.
A new field hospital in Toronto is getting some help from the military starting today and continuing until at least the end of May.
My team is very excited, and we had great volunteers from across the country to come and work today. So pandemic, no pandemic, when we have a chance to help fellow Canadians, we're all in.
A total of 58 medical personnel have been deployed to Sunnybrook Hospital. This comes just days after the province formally asked for federal help. That's not all Ontario would like to see from the federal government. Premier Doug Ford wants to see much stricter border restrictions. David Cochrane looks at the request and the response.
Intensive care beds are filling up. Other provinces and the military are sending help. But Ontario's premier says the problem lies at the borders.
Their federal jurisdiction. And I assure you, if I had the power, I would close down Pearson Airport immediately. I would shut down the land border crossings to only those who are absolutely essential.
Ford wants the federal government to impose mandatory pre-departure testing for all domestic flights into the province. And he wants a mandatory 3-day hotel quarantine for people who cross into Ontario from the U.S. by land.
The borders are broken. We need to fix it.
But data collected by Ford's own government suggests the border isn't the biggest problem. Of the 109,000 new COVID cases detected this past month, just 1,200, about 1%, were travel-related. The rest overwhelmingly from community transmission or close contact with someone who is infected.
Importation through the borders is extremely low in terms of cases in the country.
Which is why the Prime Minister was cool to Ford's proposals, unwilling to add to the federally mandated layers of tests and quarantines that already exist, instead trying to put the focus on the main driver of new cases.
We have seen that this third wave is very much around community transmission.
It's a message Ontario doctors and scientific advisors have delivered to Ford repeatedly, and repeatedly complained their warnings have gone unheeded as Ontario reopened. Trudeau says it's within Ford's power to severely limit domestic travel in Ontario. He points to the example of the Atlantic provinces and their mostly successful bubble, something done without the intervention or the permission of the federal government. David Cochrane, CBC News, Ottawa.
To slow down the community transmission that David mentioned, Ontario's latest strategy has been to boost vaccination in hotspots. Joanna Remiliotis takes a look at what that means on the ground and how communities are reacting.
This is about recognizing risk and inequity. A pop-up clinic in Brampton's Islamic Centre. 7,000 vaccines will be administered here in the next 2 weeks.
It has been scary knowing that we're in a hot zone, but I think this is a great initiative.
I'm grateful that we actually are getting the opportunity to get vaccinated.
This is part of an accelerated plan to get one shot into most of the region's 1.5 million residents in the next few weeks to get to the most vulnerable.
Brampton is home to a lot of marginalized and racialized folks who are often left out of the conversation when it comes to vaccine rollouts.
Essential workers in Peel, Ontario's manufacturing and distribution hub, are behind the region's crushing COVID rate. People who also often live in crowded housing in multi-generational homes.
The story of Peel throughout the pandemic has been a story of disparity and inequity.
500,000 Peel residents already have their first shot. It's a race to get to more.
I think the urgency is really in trying to ensure that we can actually get to a level where coverage is good enough to keep transmission and to limit hospitalizations and death.
Ontario is now sending half its vaccine supply to vulnerable areas and supporting workplace vaccine sites in Peel. Maple Lodge already started immunizing its employees. Amazon will begin next week. Meanwhile, the pop-up clinic will stay open late most days for those observing Ramadan and to make it easier for anyone else too.
I just attended 2 funerals in the last week and another one yesterday. So we have to get vaccinated. This is the only way we're going to save lives.
And every shot, here especially, is one step closer to safety. Joanna Remiliotis, CBC News, Brampton.
As for how many Canadians have had at least one dose, well, tonight that figure stands at just over 32% of the population. The first dose gives a fair amount of protection against COVID. Christine Burak looks at the latest on that.
Without a doubt, vaccines are slowing down infections, but some Canadians who've received a single shot will show up in hospitals with COVID-19.
We do anticipate that there will be cases occurring just because of the fact that the vaccine effectiveness is not 100%.
Not 100%, especially against certain variants. But a large study examining healthcare workers in the UK found that after 2 weeks, one dose of Pfizer was 70% effective in lowering the risk of infection, even when variants were rampant. A Public Health England study also found a single dose of Pfizer or AstraZeneca can cut the risk of passing the virus on to others in your household by up to 50%.
Even if it's one dose, you are protected and you're protecting your community.
But not for everyone.
I feel more vulnerable all the time.
Alan Silverman has a rare type of blood cancer. He had his first shot 5 weeks ago.
I know my potential for building immunities to this goes down with every day.
That first dose offers our body genetic instructions to build those tiny spikes on the outside of the virus. They show our immune system a piece of the enemy so that it can build defenses to protect us.
The second dose is very important for activating what is called the memory response, immune response, and the long-term protection.
A longer delay between doses often builds better defenses, but not for people with weak immune systems.
As a vaccinologist, I would not expect and not recommend somebody to wait too long if they are immunocompromised.
Giving more Canadians first doses does appear to be paying off. Still, health officials insist not enough people are vaccinated yet. Their advice, keep your distance, mask up, and get your second shot as soon as it's offered. Christine Burak, CBC News, Toronto.
Canada's vaccine supply hit another snag today. Health Canada said it's holding back 300,000 doses of the Johnson & Johnson vaccine that arrived from the U.S. on Wednesday. They were made in a Baltimore plant struggling with quality control issues, and they'll be released once it's certain that they meet standards for quality, safety, and efficacy. An update tonight to a story we broke on Wednesday. The commander of Canada's Special Forces will be leaving his current post early after it was revealed that he'd written a letter of support for a soldier convicted of sexual assault. Major General Peter Daw will move next week instead of this summer. The DND made it public this evening, a day after Daw apologized to members under his command. The victim and her husband, both military members, told CBC News they feel betrayed since Daw tried to help the attacker receive a more lenient sentence. Israel's in mourning tonight after a religious celebration yesterday turned into a deadly stampede. You can see how thick the crowd was. Tens of thousands of ultra-Orthodox Jews danced in celebration until tragedy struck. At least 45 people were killed. Officials had warned for years the annual event was dangerously overcrowded. In a moment, we'll learn about the two people from Montreal who lost their lives. But first, here's Margaret Evans with the anguish in Israel.
What began as a joyous night in full throttle at Mount Meron in northern Israel, a Jewish holy site where ultra-Orthodox Jews gather once a year for all-night prayer and celebration. No sense here of the tragedy unfurling itself in the background.
All of a sudden we saw paramedics from Madda and whatever running by, like mid-CPR on kids, and then one after the other started coming out, ambulances. Then we understood like something's going on here.
The crush apparently began when people slipped on stairs at the head of a narrow passageway crowded with worshippers, including children. Some say a barricade blocked the way, and perhaps police too at the beginning, unaware of what was happening. People could be seen forcing their way through metal siding to escape. Army helicopters carried the injured to hospital, where relatives waited and others searched for the missing. We reached a ramp where there was a river of people, says Avidor. I fell on my back and others piled on top. My 10-year-old son was screaming for help, and my 13-year-old, he was gone. Today, the Israeli Prime Minister Benjamin Netanyahu visited the site, offering condolences and promising an in-depth investigation into what went wrong. The annual gathering at the tomb of a revered Jewish rabbi was the biggest of its kind since the pandemic hit Israel. Police are said to have planned for 10,000 people, but there are reports that 10 times that many attended. Funerals were held for some victims today. Efforts to identify the bodies of others came to a halt with the arrival of the Jewish Sabbath. They'll resume at sundown tomorrow. Margaret Evans, CBC News, London.
And as I mentioned, the stampede claimed the lives of two people from Montreal. Justin Hayward tells us who they were and how much they'll be missed.
A well-known singer, Shraga Gestetner, was born in Montreal, lived in New York. Reports out of Israel say he traveled there for the festival. Today, hundreds of mourners crowded the streets for his funeral. His cousin says Gestetner recently left his singing career in favor of his family.
Jewish weddings take place any night of the week, and was taking him away from his family and other commitments that he had.
He says people who knew his cousin well knew there was more to Gestetner than a singing career.
They had more admiration for his dedication to his family and his 6 children, to his community.
Montrealer Dovi Steinmetz, only 21, was in Israel to study.
Grew up in the neighborhood, same grade as my son, and just a wonderful boy from an incredible family, loving, very social.
This municipal politician says the young man's death has hit his family hard, as well as the tight-knit community.
It's a close unit here, and for the coming days and weeks, it's going to be very, very difficult for everyone.
There's little surprise there were Montrealers among the victims, given how active the city's Jewish community is in Israel.
They travel to Israel, they have their family and friends in Israel, and now when such a tragedy happens, we see that we are all one.
One today, in mourning what is already being called Israel's worst ever civil disaster. Justin Hayward, CBC News, Montreal.
The fate of Laurentian University is in a courtroom as it tries to navigate a financial crisis. The Sudbury University insists that in order to stay afloat, it must cut ties with its 3 affiliated schools, but those schools are fighting back just days before the spring semester begins. Already this month, Laurentian has made massive cuts to staff and programs. All of it has caused stress and confusion for students. Deanna Sumanak-Johnson spoke with some of them.
Chantal Longobardi moved her entire family from Calgary so she could study midwifery at Laurentian University. As a Métis woman, her dream was to help other Indigenous women.
We see obstetrical violence, we see medical racism time and time again, and midwives help with that.
Midwifery is among 58 undergraduate programs Laurentian University cancelled after filing for insolvency. Today, the Ontario government committed to eventually finding another home for the program in the region. Until then, students like Longobardi have been assured they can continue taking online classes at the two Southern Ontario universities with midwifery programs. But she says instructors there won't understand the specific social and health concerns that go with giving birth in the North.
When you're talking about reproductive choice and just access to reproductive care in the North, it's a huge, huge loss.
Cutting programs rare or unique to Laurentian is hitting students particularly hard. Charlotte Dido majored in math and minored in English and French literature with a goal to become a teacher. Laurentian's program for educators meant they could become teachers in just 5 years rather than the usual 6, and do so in French.
I was super excited because I would be able to finish school a little bit earlier and I'd be able to do my teacher's college in French at Laurentian. But now if I switch schools, I'll lose that.
And all of Northern Ontario will lose out too, says this department chair at North Bay's Nipissing University.
What we want from universities in part is to educate our citizens and have them stay in our region, to open businesses, to add to the culture, to add to the intellectual environment. When they are forced to move somewhere else, then it is often the case that they don't come back.
Connor Lefortune, for one, doesn't want to leave. He loves his Indigenous Studies program for many reasons, including its proximity to home.
It's also an area that's full of woods and trails and hiking places, so it resembles where I'm from.
While his program is not technically cancelled, it's changing. He learned that many of his courses will no longer be taught by the Indigenous professors who developed them, but alternative classes will be offered instead.
When we look more into it, it's really just an English anthropologist view on Indigenous people, and that's really not what I signed up for.
Lafortune is considering transferring to another university, leaving the area he loves and the people he hopes to one day help as a lawyer, as students' dreams, already affected by the pandemic, take another detour. Deanna Sumanak-Johnson, CBC News, Toronto.
In Canada's overheated housing market, a growing sense that things aren't fair.
It feels like there's not a whole lot of consumer protection for buyers.
Next, the mounting complaints against realtors across Canada and calls to overhaul the bidding process. And watching the devastation from a distance as COVID cases surge in South Asia.
It's hard because I feel so privileged because I'm here in Canada, and so I feel this immense guilt because somehow I got lucky.
And a moment between a drag queen and his grandma.
You are the sunshine of my life.
The unconditional love behind the hair, the makeup, and the heels. We're back in 2.
In my heart.
The Toronto Blue Jays in Major League Baseball have cut ties with Hall of Famer Roberto Alomar. Following an investigation into sexual misconduct allegations against him, the team says it will remove a banner celebrating his retired number and his Hall of Fame induction. Real estate has become a hot property during the pandemic, with bidding wars pushing prices ever higher. Officials say it's led to a rise in consumer complaints. Jacqueline Hansen has the story.
For nearly a year, Jenny Kim and her husband have been trying to buy a house.
It feels like there's not a whole lot of consumer protection for buyers.
Kim says listing agents she's dealt with in Ontario broke industry rules, like revealing the price of other offers.
It made us wonder, about the legitimacy of these other so-called offers that she had on the table and whether they were truly higher than ours.
So she submitted 2 complaints to the Real Estate Council of Ontario. Over the past year, as prices and sales have climbed across Canada, most provincial governing bodies say complaints about realtors have jumped as well. Some minor, some more major, from allegations of not following COVID protocols to conflicts of interest or breaches of fiduciary duty. This realtor says he's also seen other agents share information about competing bids.
I would say probably 8 out of 10 times, the listing agent will give me some hint. And I think that type of thing is wrong.
Ontario's Code of Ethics says when there are multiple offers, the listing agent isn't allowed to disclose the substance of the competing offers. Though in BC, that's up to the seller. Still, critics say the blind bidding process can lead buyers to make higher bids than necessary.
You get into the situation where multiple offers results in emotional buyers overpaying, and then that overpaying becomes the new comparable sale down the street, and then everybody uses that as the next benchmark.
Some say an open auction process would be a win for affordability as well as transparency.
It would forcibly eliminate some of that unethical behavior.
Kim is still waiting for her complaints to be addressed.
I really hope that the people who have the power to change and improve things will listen.
She's hopeful her family will find a new home fairly. Jacqueline Hansen, CBC News, Toronto.
We are going to return to that new report tonight, the second this week into the failures of Ontario's long-term care during the pandemic. Next, a conversation about the very personal cost of politics and policies. Could this finally be a turning point? And what needs to change to protect our elders? As the country continues to grapple with the third wave of the pandemic, we're getting a closer look at what went wrong during the first and second waves at long-term care homes, especially in Ontario. This week, the province's Auditor General report confirmed what so many had been saying. The system was not ready for the pandemic.
Some decisions were taken that complicated the long-term care home's ability to deal with their residents.
And today, a second report, this one from the Ontario Long-Term Care COVID-19 Commission. The province's premier promising action even before reading its findings.
I will not stand here and try to make excuses or pass the blame, but I will stand here and tell you that I'm doing everything in my power as premier, and I'm sparing no expense.
Well, let's get a couple of perspectives on what needs to happen next in long-term care homes. We're joined by Jacqueline Mitchell, whose mother is in an LTC in Ontario, and Isabel McKenzie, the BC Seniors Advocate, an office that monitors senior services and issues in the province and is independent of government. And Jacqueline, let me start with you. Your mother is in the Eatonville Care Centre in Toronto. She has been there throughout the pandemic. How's she doing?
That's a difficult question to answer because I haven't been able to see my mother since the last time I saw my mother was April the 5th, and that was a window visit. The last time I saw her before that was December the 3rd, also a window visit. The time before that was October the 3rd. And each time my mother is deteriorating, she doesn't open her eyes. She doesn't speak. She's wearing a mask. I cannot see her. I cannot make contact with her. There's no bonding for us. So it's very, very difficult. So how is she? She is alive. She is breathing, but she has no quality of life.
That is so difficult to hear. I want to play a clip and get your reaction, Jacqueline, in a moment. The Minister of Long-Term Care in Ontario speaking this week. Here's how she responded to the Auditor General's report.
As the Minister of Long-Term Care, I have a responsibility, a duty, an obligation. But in terms of really raising the importance of long-term care and addressing the shortcomings, addressing the failures of the previous government, yes, I'm doing that.
Jacqueline, when you heard that clip earlier this week, what was your reaction? What is your reaction?
I turned the TV off because her arrogance in saying that, she annoyed me. It was painful to listen to. It didn't acknowledge the human suffering. It didn't acknowledge that almost 4,000 people died on her watch in Ontario. It didn't acknowledge that the tone is from the top. She owns this issue. I am not blaming her for the pandemic, but she has to own it as the leader. And she cannot play the blame game. She cannot blame previous governments. That is insensitive to all the people who died. That is insensitive to me, who I can't see my mother. So that's how I responded to it. I literally turned the television on.
Isabel, we know a lot of people are hoping this pandemic is going to be a turning point for long-term care in this country after we've just heard so many heartbreaking stories about what's been happening inside so many long-term care homes. Do you think it's going to be a turning point?
I do, Ian. I think that Canadians have been awakened to life in long-term care in this country. And I think that that will be a turning point. We need to remember that most Canadians have never seen the inside of a nursing home. And now, through this pandemic and the images on their screens and discussions over the radio airwaves for the past year, they understand what life is like, and they're saying we need to do better.
This is a big question, so you'll have to figure out, Isabel, what part of this you want to take on, but what needs to be done to fix the system?
Well, a number of things. You're right. It's a big question. So certainly for some, it's about the physical infrastructure, this issue around 4 people sharing a room and 3 people sharing a room. The degree to which it has to be fixed is different in different provinces. It's probably most acute in Ontario and Quebec, and to a lesser extent in provinces like BC. But then there's the staffing issue. Who is going to be in that care home on a day-to-day basis? And Jacqueline will certainly know this from her experience with her mom. The quality quality of life is determined by, is there somebody there when I need their help? And is there somebody there to listen to me and to make me feel valued? And that comes down to having enough people and to having the right kind of people and to making the people who live in residential care feel as important as other customers in the rest of Canada that are served by people who are paid a lot more than some of the people working in our care homes are.
You're right. It is the first time a lot of us have seen inside those rooms, and some of the pictures from Ontario of 3 or 4 beds. I mean, to me, it seemed kind of jammed together in a room. I was shaking my head as I saw it. Jacqueline, from your perspective, a very personal and very valid perspective, what message do you want governments to hear?
Well, I want, first of all, I agree with some of what Isabel has said in the sense that we need to look at, accommodations. We need to have a sort of like a resident-focused or client-focused approach. So we can build more rooms. We can build, throw more brick and mortar at this whole problem. We can throw billions of dollars like the minister, said that she was doing. That does not fix the problem, because to me, that is all knee-jerk response. We need to step back. We need to identify, not just, we shouldn't conflate what happened in the pandemic with a long-term fix. We need to say, what is this? We need to have a vision, and we need to have a strategy for that vision. And then we can get down to the tactics of how we're going to fix the problem. Think about the duty of care you have towards residents. And that duty of care is really one of life and death. If you do not have accountability and enforcement and oversight, people are going to end up literally dying, because you have to spend the money under compliance. You have to create a new system that is independent of government. But you also have to understand that the cost of non-compliance is literally people die. In the case of the pandemic, almost 4,000 people died. That's what
Isabel, what's your view on that?
I agree. I think that the message to government would be the role of government is regulatory and enforcement, and that we have to remember that the person we are caring for in long-term care needs us to ensure that they are receiving the best possible care that they can. And we need to have regulations, we need to have oversight, we need to have independence of that oversight, and we need to have the tools necessary to provide confidence that our seniors are getting the care that they need.
It's going to be interesting to see. There's obviously a lot of concern about this among the public. Can that turn into political will, and will there actually be meaningful change? Thanks to both of you for speaking with us on this topic tonight.
Thank you, Ian.
And we did ask for an interview with Ontario's Minister of Long-Term Care, Mary Lee Fullerton. Her office did not respond. As cases surge in South Asia, those with family affected are watching anxiously.
The only thing which at this moment I can do for my family is prayers.
Up next, we'll hear from 3 South Asian Canadians feeling helplessness, but also some hope. And later, a big question for a lot of parents: what could summer camps look like this year? We'll look at what it would take to keep kids safe. More aid arrived in India today as the country grapples with the world's worst COVID crisis. Another one-day record today, 386,000 reported cases. On top of that, India is quickly running out of vaccines and oxygen for patients. For Canadians with families in India, it's been a devastating situation to watch from afar. Some of them opened up to us about how they're coping.
It really stresses me out when I see all these pictures because this is creating fear, anxiety in our minds.
Millions of people have died. As the days and weeks and months go by, people are going to be worried and they are going to be more tense.
Seeing those images of people lying on the street connected to an empty oxygen cylinder, how does that not break someone's heart?
My name is Neha Gupta. I have been immigrated in Canada around 1.5 years ago. My dad, my brothers, my sisters-in-law, niece, nephew, they all are living in Delhi, and I am living here in Canada all alone. My dad, my brother, and my sister-in-law and their 2 children, all of them had COVID.
My name is Haroon Khan. In Pakistan, we have a much lower degree of infection. Having said that, we have personally lost family. We've lost some of our uncles, our aunts, even some of our nephews and nieces to the coronavirus. So it is a real human toll that has been taken.
My name is Sabina Vorher-Miller. I am a first-generation Canadian. I moved to Canada, in fact, 20 years ago. My only family that exists here in Canada is my brother. Our entire family is basically in India. We're calling family and friends on a daily basis, seeing how everyone is doing. And then there's that fear when someone doesn't, answer your calls or respond to text messages and is, are they okay? Is everything all right? And it causes so much anxiety, and I constantly feel like my heart is in my mouth the entire day.
When my dad got it, my brother contacted the doctor to get the immediate medications. There comes a day when oxygen level goes down, and it happened with my father and with my sister-in-law also. My brother kept contacting, and somehow we were able to manage oxygen concentrator on rent as a backup for emergency.
The issue with having people who've contracted coronavirus in Pakistan, they have great medical care for some, but not for all. And so there is difficulty and there is fear. But the images coming out of India are extremely heartrending. It brings tears to the eye. We're all brothers and sisters here.
I think that the most challenging part for South Asians that live in Canada right now is that we are fighting 2 pandemics. We're fighting one pandemic that is occurring right here and also in India. And it's hard because I feel so privileged because I'm here in Canada and there are millions out there who just don't have that access. And so I feel this immense guilt because somehow I got lucky.
I was feeling like I'm caught in some jail where I can't even help my family. I am healthy and I can do everything for them, but I was feeling so helpless.
Mosques and community organizations have all joined hands. People are donating directly to various relief organizations that are on the ground in Pakistan and in India, where this is the flashpoint and people are in desperate need.
My entire family is in fact in Delhi. And my father comes to visit when he can. And as luck would have it, he was here visiting before the pandemic started and has been stuck here since then. And it's just such a relief for me to have my dad here with us, safe in our house. And I feel for everyone whose families are still elsewhere, so far away.
I just keep saying to my mind that the only thing which at this moment I can do for my family is prayers. Only prayers and have faith in God. That's it.
Pakistan's motto is unity, faith, and discipline, and we're going to have to live it. We'll get through it.
And we will continue to follow the story in India here on The National. With so much uncertainty around the pandemic, some summer camps are already making tough decisions.
My 15-year-old, her mood has changed because she was really looking forward to reconnecting with her friends.
Up next, how parents are struggling to make plans, and camps are looking to keep kids safe.
I'm Jamie Poisson. Join me for CBC's daily news podcast, Front Burner. Every weekday, Front Burner takes you deep into the stories shaping Canada and the world. Subscribe wherever you get your podcasts.
Welcome back. As we get closer to summer, some parents may be wondering if it will be safe to send their kids to camp, a place that isn't just fun but teaches life skills. Deanna Sumanag-Johnson on what may be ahead.
Gaëtan Vernat is a big city professional, but a camp kid at heart, a love she passed on to her teenage daughters.
I always felt that camp was a really great place to work, to learn to work as a team, to meet new people, to be away from your parents.
So learning that their family's camp of choice in Quebec will not operate this summer has been rough.
My 15-year-old, you know, her mood has changed because she was really looking forward to reconnecting with her friends.
Last spring,
in BC, both of Lisa Cadane's children reaped the benefits of camp, but her son, who has autism, especially so.
we just felt like he had grown in independence and he tried a lot of new things.
But this year, like last, his overnight Easter Seals camp has been turned into a day camp.
the immersive experience is super important. And day camps are great, but it's just not the same experience.
While some camps have made their own decision to cancel or change summer plans, others are awaiting provincial guidance. Jack Goodman has been working on a safety protocol list he hopes will satisfy the Ontario government. Among his recommendations,
we'll keep cohorts separated by the required distances. And if they can't distance appropriately, they'll wear masks. We'll eat more outside. We won't yell and scream and cheer in the dining rooms, but we'll do it outside.
This epidemiologist would also like to see some additional measures to prevent the spread of the virus.
We can use rapid testing, especially on the adults in camps, to make sure they are not transmitting. But the single best way to keep camps open is the single best way to keep schools open, and that is keep it out of the community.
As the community vaccination rates rise as the summer approaches, there is hope. The problem is decisions about camps need to be made now to give them enough time to set up safety measures. A tough call for any government to make in the still dark days of the third wave. Deanna Sumanak-Johnson, CBC News, Toronto.
Next, a special visit for a grandmother in palliative care. This drag show is a family affair. The special meaning behind the performance right after the break.
You are the apple of my eye.
A surprise drag show for a grandmother in palliative care. Her grandson, who's relatively new to drag, wanted her to see him perform and to bring a smile to her face. Not only did he succeed, but he's managed to bring a smile to millions more who have watched and shared that video online. Their moment together is tonight's moment.
I definitely wanted to go and perform for her in drag, whether she was going to be asleep the whole time or not. You know, I wanted to treat it the same as like when I go on stage. I wanted to give her a really good show, and we went in. I got my mom to sort of like wake her up, perk her up a little bit, get the room ready. We set up some disco lights and set up a speaker and everything. Like seeing the look on her eyes after, like I was very in the moment, so it was hard for me to like really see it until, and that's why I'm glad that we recorded it. Hopefully this will encourage people to, you know, completely be themselves with their family members and hope that they'll accept it. When I was 18 and I was coming out of the closet, she was actually the first family member that I told, and it was really like a beautiful example of unconditional love. I'm so grateful for the relationship that I've had with her. I'm so happy that I'm gonna have this moment for the rest of my life.
If you're wondering about Eric being in there during the COVID times, it's because he and his mother are essential caregivers for his grandmother, so they were allowed in. As for that song, Stevie Wonder, You're the Sunshine of My Life, if you don't know the song, maybe listen to it later on YouTube. The lyrics are, as he points out, just perfect. And ABBA, just because. You can play ABBA anytime you have an opportunity. That is the National for April 30th. I hope you can join me on Sunday for Cross Country Checkup on CBC Radio at 4 p.m. Eastern, 1 Pacific, and then later that evening back here on the National. Good night.